All right, North Carolina needs more beds for people who are struggling with mental illness.
There are fewer than 500 state psychiatric hospital beds. This is according to new data. WRAL's Ali Ingersoll looks into how the push to rectify this issue is going.
Since 2016, North Carolina has lost about half of its state psychiatric beds, dropping from about 900 to 450. And that came as the population grew.
The number of inpatient psychiatric beds had not kept pace with that population growth, and in particular with the exacerbation, the worsening of mental health concerns.
That's UNC's Department of Psychiatry chair, Dr. Samantha Meltzer-Brody. She says the state and country have been losing spots for patients with mental health issues for decades.
Unfortunately, what happened was we ended up with far too few beds, not enough community services, and not enough access for care.
In the 1950s, there were about 340 inpatient beds for every 100,000 residents in the country. Now that number is down to around 11. And in North Carolina, it's even lower, at about 4 state psychiatric beds per capita. Researchers have found that the optimal number of beds per 100,000 people sits between 40 and 60. Meltzer-Brody says she's hopeful, though, as the state is making an investment to address the shortage and the issues with treatment and care, allocating an estimated $750 million to mental health care.
Ultimately, getting care and treatment saves lives. And people suffering in silence, not getting care, and certainly not getting care because they're worried about the stigma and end up ending their lives or having terrible outcomes. That's tragic and heartbreaking. There is so much we can do with treatment, and it really can be such a wonderful intervention that changes the course of that person's life for the better.
For WRAL News, Ali Ingersoll.
North Carolina is one of 19 states that has seen the number of beds decrease by more than 20% since 2016. Just 6 states increased the number of staffed beds by more than 10% in that time.